As 2025 draws to a close, I find myself reflecting on the quiet but deliberate progress we've made applying artificial intelligence to healthcare. This year was not defined by headlines or hype. It was defined by steady progress, by foundation building, progress that has prepared healthcare for the years yet to unfold in this transformative decade of rapid innovation. Much of this progress remains invisible to patients, but it is reshaping how care is delivered. Ambient listening tools now capture and summarize clinical encounters, giving physicians back precious minutes with their patients. Digital assistants and chatbots handle scheduling, follow-up questions, and routine communications, closing the gaps that once caused frustration and delay. And platforms like Open Evidence go even further. They analyze medical literature in real time to help clinicians identify potential diagnoses, review evidence-based treatments, and create personalized explanations for patients. These are not replacements for clinical judgment. They are intelligent collaborators, tools that extend the reach of knowledge while keeping compassion and accountability in human hands. AI's visible impact on outcomes is still modest, but its invisible influence is profound. Administrative friction is falling. Decision support is improving. Most importantly, clinicians are reclaiming the time and focus that bureaucracy once stole. What comes next is not celebration, but resolve. The resolve to ensure that our progress always reflects the moral core of medicine. Medicine has always depended on trust, an ancient bond that predates both science and technology. At its heart lies the trust covenant between caregivers and those who seek their help. It is not a contract written on paper, but a bond written into the conscience of every clinician and the expectation of every patient. Patients freely give their trust, not because they must, but because they believe their caregivers and the institutions behind them will always do what is right. The trust endures across generations, unless broken by neglect or deception. That covenant carries obligations on both sides. Clinicians pledge to act selflessly, to relieve suffering, even at personal cost. Patients, in turn, accept risk that allows medicine to advance. Each year, thousands volunteer for clinical trials, knowing the therapy may not help them directly. They do it to offer knowledge that may help others, a quiet act of heroism that keeps medicine learning and moving forward. When anesthesia was first introduced in the 19th century, physicians and patients faced the unknown together. Surgeons risked their reputations. Patients risked their lives. Families waited outside operating rooms, torn between hope and fear. Out of that shared faith emerged one of humanity's greatest achievements, the transformation of surgery from a painful agony to a compassionate practice. And so it must be with AI. The patient still walks in the clinical encounter believing the clinician, the institution, and now the algorithm are aligned in their service. That expectation is both a privilege and a responsibility. The trust covenant remains the foundation of care, constant, even as medicine evolves. Technology cannot sustain that covenant on its own. It requires human stewardship. The next leap in quality and safety will not come from more powerful algorithms, but from the systems that oversee them. AI, like any potent therapy, must continuously tested, monitored, and improved. Clinicians must remain at the center of that oversight, interpreting results, recognizing limits and taking moral responsibility for their use. To achieve this, healthcare needs new forms of collaboration, structures where governments, academia, and technology firms share the responsibility and are accountable. One such model, the Healthcare AI Review and Transparency, or HART, proposes exactly that. It would create a transparent, public-private partnership to keep AI safe, ethical, and effective. We have done this before. At the dawn of the 20th century, dangerous elixirs and contaminated tonics filled the market. Public outrage led to the creation of the Food and Drug Administration in 1906. The FDA did not stifle innovation. It made it credible. By insisting on transparency, labeling, and testing, it transformed suspicion into confidence and gave birth to the modern pharmaceutical industry. AI stands today where pharmacology once stood, full of promise, yet vulnerable to misuse. Establishing trusted oversight now will decide whether AI becomes healthcare's greatest instrument or its next cautionary tale. As intelligent systems become part of clinical care, the trust covenant is evolving into a trust compact, a shared understanding among clinicians, patients, and technology. Patients are becoming more active participants rather than passive recipients of care. AI tools now help explain imaging, interpret lab results, and manage chronic conditions. A patient newly diagnosed with diabetes can use an AI-enabled health coach to understand how diet, medication, and exercise work together while their clinician oversees adjustments. Participation becomes easier, conversations more informed, and outcomes more lasting. Clinicians gain patients as partners, engaged, prepared, and better able to contribute. AI becomes the translator connecting data to human experience. The printing press once broke the monopoly of knowledge held by the few. It democratized information, enabling citizens to read, reason, and participate. What followed was not chaos, but enlightenment, a culture capable of questioning and learning together. AI, like the printing press, can democratize understanding. It can make medical knowledge accessible and personable, allowing patients and caregivers to share a common language of health. The clinician remains essential, interpreting, guiding, and caring. But knowledge itself becomes shared property. Looking ahead, I'm confident that AI will deepen, not diminish, medicine's humanity. Used wisely, it can reduce administrative burden, improve diagnostic accuracy, and extend access to care. But its greatest impact will come from restoring the one thing technology can never replace: the time and trust between patient and caregiver. The trust covenant, our promise to act with empathy, integrity, and respect, remains unbroken. The trust compact, our invitation for patients to share that promise, defines the path forward. Next year, I will explore this relationship further in my forthcoming book, iPatient, which examines how individuals can navigate the healthcare system as informed, empowered partners. As medicine moves from a trust covenant to a trust compact, we carry forward the same values that have guided us for centuries: empathy, integrity, and respect for every life we touch. With AI as our ally, patients can join caregivers as true partners in care, sharing knowledge, making informed decisions, and taking on shared responsibility. Together, we'll shape a future where compassion and intelligence work side by side, and health becomes a journey we navigate together.